So how do you determine once you've, whatever it is that you have prescribed, whether it's, quote, working or not, whether they're taking it or not, whether all the other factors that influence whether a drug is working, again, that vague term, or not, how does
Right.
that happen? What do you do?
I think that's a really good question because, y- as we know, as therapists, clients don't always tell us everything,
That's right.
right?
Yeah. Yeah.
And whether or not I'm a therapist or a prescriber or both, the client may not always tell me everything.
Uh-huh.
So it's just like any other, therapy session. I'm doing detective work
Uh-huh.
up now about medications, right? And I also and often what's been interesting as I've become a prescriber from a therapist, there's this white coat effect, that happens where the somehow now the client sees me as someone they're trying to please, right? And so
Yes.
they come back
Yeah.
and they say, "Oh, I'm better. Everything's fine," right? Because they want to be the good client,
Yeah.
and
Yeah.
they're responding to the medication. And so I have to kind of slow down and say, "Well, let's talk about, what were the last 3 weeks like for you?" And
Mm-hmm.
just like my using my regular therapy skills, tell me about what's been going on, the highs and the lows. And one thing that I find is if I just ask the client, well, how are you doing? They're often going to minimize their continuing symptoms, right? And
Mm-hmm.
sometimes that's because someone who's had a long-term mental illness may not realize that their normal might not necessarily be
Uh-huh.
uh, an illness,
Yeah.
so sometimes you'll have someone come back and say, I didn't know I could feel this good. I've been depressed for 20 years and I didn't realize, wow, I don't have to think about suicide every day. But to me, maybe they think they've made a miraculous recovery, but I need to say, well, now tell me, what is your sleep like? What's your energy like during the day? Now, how often are you thinking about suicide, right? Or now, how often are your panic attacks and how long do they last?
Mm-hmm.
And someone might say, well, now I'm only having, suicidal thoughts 2 days a week instead of every day. Well, to them, that's much better. But to me or to us, that's still a problem.
Yeah.
And so I certainly use a lot of those same, therapy techniques um, that I use as a clinician when I'm not prescribing to try to get the real story of what the person was really feeling.